Planet Vero Studio is powered by the Nolan Group of RE/MAX Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vick Soulé.
Good morning and welcome to Community Conversations. As the intro implied, I am part of Treasure Coast Community Health and have been for many years, and I am honored in that role as CEO to interact with a number of great healthcare leaders that we have in our community. And so today I've asked one of those great leaders, Dr. Peter, from Indian River Hospital, now known as Cleveland Clinic Indian River Hospital, to join us. Dr. Peter is our Chief Medical Officer there and very aware of what is going on with the topic of today, tomorrow, hopefully not too much longer into the months, but we're still back on the COVID train. So welcome, Dr. Peter.
Yeah, good morning, Vicki.
Tell us a little bit about what's going on locally from your perspective.
Well, I think since the beginning of July, we've had an increased COVID surge. We're saying that the numbers are increasing exponentially. I think that's probably an understatement. I don't know that the community fully appreciates how severe the surge is at this time. We're seeing younger patients who are affected. We're seeing sicker patients who are coming in and requiring high flow oxygen and ventilators, ICU care, those types of things. And we are seeing hospitalized numbers that exceed what we had seen previously with our surges.
Really?
Yes.
So when you're talking younger, are you talking like people in their 40s and 50s?
We're talking about folks down to their 20s. But we're seeing individuals in their 20s and 30s, 40s. And previously, we just didn't see 20-year-olds and 30-year-olds on ventilators in the ICU.
And are those younger people already sort of health compromised, overweight, smoking, have some underlying medical problem like hypertension or diabetes?
I think in general, they have some of those things, but not to the degree that we saw previously, where we had a more elder population that was affected, and they had many more comorbidities or other illnesses. But they do have some of those things. It could be obesity, which is pretty rampant in the country at this time.
And smoking as well.
And smoking as well.
So people think that those are sort of benign conditions that won't lead to anything more serious. I guess that's my rationale in asking you about that, because we all like to think that it's happening to somebody else.
Well, I think what we're seeing as far as risk factors for the patients, number one, first and foremost, is vaccination status. So if they're unvaccinated, they're at a much higher risk. I think those other things, smoking, obesity, etc., they certainly can play a part, but almost without exception, the number one risk factor is your vaccination status.
Despite whatever radio station or television station you happen to tune into that argues the point against it.
Well, when we look at it, what we're seeing is about 90 to 92% of our patients who end up hospitalized are unvaccinated. And maybe 8% of the hospitalized patients have been vaccinated. When you look at patients that end up so sick that they're in the intensive care unit or on a ventilator, or if they should die, those are almost exclusively unvaccinated persons.
And the facts don't lie.
That's what we're seeing.
Okay. So what kinds of changes has that caused at the hospital?
We are postponing or rescheduling some of the elective surgeries, and that's so that we can free up the personnel that typically would take care of those, so they can work in some of our other areas and support some of our other needs. Staffing has been a challenge for all hospitals, and that's not just Florida. There's a nursing shortage that certainly predated the COVID pandemic, but the pandemic has made that worse. So, we are definitely staffed at this time. We're taking care of the folks that we need to take care of, but it is more challenging in this particular environment.
Yeah, we are finding the same thing. We have a number of people who will quarantine before they get the PCR results back if they haven't been vaccinated, because they recognize that that's a responsibility. And that causes some staffing challenges for us as well. And the only thing you can do is postpone elective things and take care of those that are sick. So we are actually going back to our telehealth for individuals that are sick. Instead of coming in and saying, I think Johnny has whatever, maybe you should give us a call first and let us advise you in terms of the risks and rewards of doing something by phone first. Again, in the greater interest of taking care of people in the best way possible, both that individual, their family, and our extended TCCH family.
Yeah, we've seen the same thing. And we are very careful with all of our caregivers. Mm-hmm. If folks have any symptoms, we do want them to stay home, be tested. Mm-hmm. And we have the same return to work policies that are recommended by the CDC, 10 days and then mm-hmm. 24 hours with no symptoms. I think as we look at it, the other thing that we have changed is our visitation policy. Mm-hmm. So we had gotten down to what we call level orange, which was a little bit more, a little bit looser visitation policy, a little bit broader.
But still cautious.
Very cautious.
Color makes sense.
And then we went back to level red. And so currently we can have one visitor, and we don't have visitors for the COVID patients. Mm-hmm. And we are doing the best we can to keep the patients and our caregivers and the community safe.
It is a difficult thing. I've heard from some younger folks their frustration at not being able to be with their loved ones when they are hospitalized. But again, that's that balance between the individual, their individual choices, and the common good. And when you're in healthcare, you have to consider all of those.
Our focus is on safety first and foremost. And that includes the patients, their families, our caregivers, the community. Mm-hmm.
So what do you think is going to happen? Can you rub your crystal ball just a little bit? Is this, as they say, in your opinion, something that's going to be a short blip as it was over in England, or are we in for another maybe 6 months of this? Any ideas from the scientific community?
I think what we're seeing in the United States right now, to some degree, parallels what we've seen previously, both in the UK, so England, mm-hmm. and also India. And I think with the Delta variant, we would look forward perhaps another 4 or 6 weeks, okay. and say that, if the surge follows the patterns that we've seen elsewhere, then we would think that it would be right around that time period. So as we do our planning as to how we're going to respond to mm-hmm. the COVID surge, we're looking about 4 to 6 weeks ahead. Obviously, if it lasts longer, we'll be prepared. Mm-hmm. But we don't anticipate at this time that it'll last less time.
Yeah, I think the only complicating factor might be that I don't believe that they had to deal with schools reopening with the maskless mandates going back and forth in those countries. So it is good to know, though, that if all goes well, it could be short term. I hear over and over again, I hate this darn mask. I want to take this mask off. If you know that something is more short term than a forever, you can kind of fool yourself into saying, I can get through this. And you do. It's not really fooling yourself. It's just coping for that moment. So we're going to all keep our fingers crossed and continue washing our hands. And what are the other parts?
Social distancing.
As we are here in the
wear
studio.
Your mask. and vaccination.
Yeah.
And I think I would probably reverse the order on those. Without a doubt, the most effective thing we have at this time is vaccination, followed by the masking and social distancing and washing your hands. Those are the current CDC recommendations, and that's what we would recommend.
Well, I think we're going to take a short break for a word from our sponsors, and then we'll come back and we'll talk about some other elements of this total healthcare and COVID aspect. Thank you. Hi, I'm Vick Soulé, CEO of Treasure Coast Community Health. Indian River County is one of the top 10 richest counties in Florida. Yet, half of our families are underserved in medical, dental, and behavioral health care. TCCH, a nonprofit, believes in health care for all. Children need well checks, women need mammograms, men need annual physicals. Please consider partnering with TCCH to help meet the needs of our community. 100% of your gifts stay here. To donate, visit tcchink.org.
Visit fellowship-trained Dr. Sarah Kadadaday for the latest in glaucoma treatment and custom cataract surgery at New Vision Eye Center. Dr. Kadadaday received her fellowship training at Yale University and is board certified by the American Board of Ophthalmology. Call for your consultation at 772-257-8700 or visit newvisioneyecenter.com. World-class eye care on the Treasure Coast. That's New Vision Eye Center.
Have you shopped at the Habitat Restore lately? This is one place that everyone must visit. It's become a regular weekly stop for many who love the thrill of discovering all the newly arriving merchandise. We've become popular because of the generosity of so many Indian River County residents and businesses that donate goods. To start with, we have a deconstruction crew that removes building materials for the purpose of reuse. Through resale, the Restore continues to support the Habitat goal of serving families in our county. Of course, there's more to see. The Restore's massive showroom displays furniture for every room, all in great condition. Shoppers will love the layout, which separates departments including plumbing, home accessories, electronics, lawn and garden, tools, sporting goods, seasonal goods, and more. The Indian River County Habitat Restore is at 4580 North U.S. Highway 1, just north of 45th Street. Tax-deductible donations can be dropped off, or we'll come and pick them up for free. Online at irchabitat.org.
And welcome back to Community Conversations. If you're just joining us, I have the pleasure today of having as my guest the Chief Medical Officer from Cleveland Clinic at Indian River Hospital, Dr. David Peter. And we've been talking about what else? COVID.
Yes, what else?
What else? So when we talked earlier, we talked about the surge and how we hope it will be short term. But again, all the precautions leading with vaccination. We've had a number of people that Treasure Coast vaccinated real early in the year, late December, early January, and they are now starting to say either, I have COVID anyways, or I don't want to get COVID, and is this what you call a breakthrough for me to be exposed? And so we remind people that even at the very beginning, the most effective vaccine was posted at somewhere between 92 and 94% effective, which means out of every 100 people, there are going to be 6 to 8 where the vaccine just doesn't work. Most of those, none of the vaccines work on them. They have a funny immunology internal core, and it just doesn't react in the way you would most expect it to. So when I hear that some folks are still getting COVID, as a matter of fact, I had a nurse practitioner this morning tell me that she self-quarantined until she got her PCR, and yes, it was positive, even though she had vaccinated early in the year. But she was so grateful because she knew that being at home and feeling yucky was so much better than being unvaccinated and ending up at the hospital. And she wanted that message to go out. So there's to you, Becky. But anyways, she has been very honest and open about it in terms of encouraging others. And I hear a lot of differences in these questions and concerns and information that they may have gotten. When you're asked that question, how do you answer it?
Well, I think we expected that there would be some breakthrough infections. We've known for quite a while that the COVID vaccine is not a sterilizing or perfect immunity, but it is immunity. And, I think as we look at it, that 92 to 94% effective, we're looking that it very seldom will we have an individual who has no additional immunity. Okay. So The real thing is, does it prevent the worst of the disease? In other words, can a person who's been vaccinated end up getting COVID? Some of them do. Mm-hmm. They tend to have a milder illness. They certainly tend not to end up back in the hospital or being hospitalized. And we've seen almost no deaths or that type of thing in patients who are vaccinated.
That's a huge statement when you consider where we were at just a year ago.
That's right.
That's a huge increase. And I believe in free choice, but I also am a scientific data-based gal. And so I have a hard time understanding why people would not do that. But I hear the common concerns and questions reduced to 3 or 4. One is about the RNA itself and how new it is, and they are waiting until the FDA gives final approval. Do you hear something similar? And from a physician's point of view, what do you think of that?
I really wouldn't challenge what someone believes. So, we are doing our best to walk that fine line, to be both respectful and at the same time to offer what we think is the strongest solution at this time. I don't have a way of countering some of those discussions. I think we've gotten to a point where the facts aren't necessarily enough, and once you reach that point, it's very difficult. So we are being very respectful of individuals. We want to make sure we treat them and take care of them appropriately, whether they're vaccinated or not.
You're a wise man.
And, do we recommend vaccination? Yes, unequivocally. But again, I think these are things that I'm certainly not going to solve right at this moment.
No, and the myths have been disclosed with fact-based answers for some months now. And you're absolutely right. There are a lot of folks that are not satisfied with the decision one way or another, but it is a personal decision. So I thank you for that a guided answer. I know there's a lot of parents out there that would like to push one way or another. And as your child gets older, as you pointed out earlier in our conversation privately, when they get to a decision-making age, as evidenced by their parents, then they have the right to make that as well. So it is sort of a tricky slope that we haven't been on before.
Yep. Well, I don't want to be unclear. I mean, at this time, the recommendations are vaccination, and vaccination is effective, and practicing the social distancing, masking, hand hygiene, washing your hands. Mm-hmm. We are very consistent with what the CDC is recommending, so we try very closely to follow that.
Mm-hmm. As we do as well, and so I thank you for being here. Are there other things that you would like to share? We have just a couple of minutes left before we wrap up.
I think that
it's your microphone time.
Well, I think there's been some good things that have come out of COVID. I think they were intentional. So I think that a lot of individuals in the community have brought about these successes and brought about these positives. But to name a few, we've had tremendous collaboration across Indian River County and Vero Beach, the hospital, the public health department, organizations like you, the TCCH and the FQHCs, and up to 40 or 50 of the not-for-profits that are here in Indian River County. I really would call out VNA, Visiting Nurses Association. They've done a fabulous job and coordinating a lot of these efforts.
Yeah.
The hospital has been in the middle of a lot of these efforts, and the public health department here in Indian River County is just doing a tremendous job.
They are. A lot of coordination behind the scenes. with the Emergency Operations Command Post. I know we always think of that more in hurricane, but the reality is the EMS and firefighters groups have supported a lot of the COVID-related initiatives over the last year. And it's wonderful that any of us, I think, can pick up the phone and say, what do you think about this? Or could you give me some manpower if we do that? You're right. The collaboration has been intentional, but outstanding.
And I would call those groups out also. So the EMS providers, firefighters, all of the folks through emergency management. I think that we're also doing what we're doing right now against the backdrop of potential hurricanes and weather. I think we need to be prepared for both as we move forward.
Well, if we do have something stronger than a tropical storm that enters into a hurricane, what changes do you expect the hospital may have to make in that case? Annie?
Well, we have an entire hurricane plan, and we are always preparing for that. So I would say that the Cleveland Clinic hospitals will be prepared just like we always have been. And we are now factoring in how to care for COVID patients while preparing for weather. So I think we will be as prepared as one can be. And that I would extend that to the community, because I know the community is doing that same type of planning.
Yes, they are. I know the Department of Health has changed some of their original plans from years of experience into factoring COVID, and as has the school and Treasure Coast and VNA and a number of different folks. But as we get closer into September and the tropical storms seem to heat up into more windy events, I know it's on everyone's mind in terms of, well, now what? I would also encourage folks, if you think that you have COVID, call your physician and talk to them about it. Don't necessarily come in for an appointment, because the reality is we want to keep you safe and keep everyone else safe. Phones and video conferences are definitely a positive that has come out of COVID. 2 years ago, we were like, what? Is that like FaceTime? I don't have a phone like that. But now we can certainly take advantage of that technology. Call and see what their suggestion is and whether you need a COVID test. Like everything else, supplies are limited in everything. You can't just go to the backyard and pick a COVID test material off the back tree. So not that there is a problem right now, but again, everything has a balancing point. And so we want you to stay safe. If you are positive, we want you to quarantine. If you're not, that's great, okay? And testing is really in the confluence of flu and anxiety of going back to school and COVID. A lot of those symptoms overlap. So give a call out to your primary care physician and let them help determine what your best approach is.
That sounds good, Vicki.
Thank you very much. I've been doing this more than a day.
Oh, yeah.
But thank you so much for being here with us today. I'm hopeful that we can have people share this on our Facebook account so that others can gain the wisdom of your experience and your knowledge of our local community. And thank you so much for giving up your time today. I know you're a very busy man.
Thank you, Vicki.
You're welcome. And folks, next week we'll be back with another well-known guest. I'm not going to let you know who yet, but you will be surprised and I hope delighted. So I wish you a wonderful day, a wonderful week. And again, stay safe, wash your hands, socially distance, wear a mask, and above all, if you haven't gotten a vaccination, seriously consider it. Thank you and goodbye.